World Cancer Day in order to create awareness, inspire change, and reduce the global impact of cancer. The aim is to reduce misconceptions surrounding cancer and the prejudices associated with it, to help people in getting the right information about it. I welcome you all in today's webinar on cancer care in India, how much we have achieved. We have with us our expert speaker, Dr. Lalit Kumar, professor and head of the Medical Oncology Department at Dr. B.R. Ambedkar Institute, Rotary Cancer Hospital, All India Institute of Medical Sciences, New Delhi, Director General Pushpa Gujarat Science City, Dr. Nilima Jairath, and Dr. Rajesh Grover, Director Science City. I invite Director General Pushpa Gujarat Science City, Dr. Nilima Jairath, Madam, to please welcome the guests and the participants. Ma'am, please. Before that, I would like to introduce Ma'am to all of you. Dr. Nilima Jairath is a double gold medalist and a state awardee for her work in science and environment. She has undertaken certificate courses in environment and sustainable development from International Center for Conservation Education, UK, Smithsonian Institution, USA, and Uppsala University, Sweden. Prior to joining as Director General Science City, she was Executive Director, Punjab State Council for Science and Technology, and founder member secretary of State Biodiversity Board and State Innovation Council, and has been instrumental in establishing the Patent Information Center, Climate Change Knowledge Center, Envis Center, and Regional Center for Education on Sustainable Development. Pushpa Gujarat Science City received the National Award for Science Communication in 2016 under her leadership. Ma'am, please.
Thank you, Loveleen. Thank you so much. And a very good afternoon, Dr. Lalit Kumar, Padma Shri awardee, all the teachers and the students who have joined us here. In fact, I would say that it's a great honor for us to have Dr. Lalit Kumar with us. सर, आपका बहुत बहुत शुक्रिया कि आपने हमारे लिए और हमारे बच्चों के लिए आज टाइम निकाला. Dr. Sab is a famous oncologist like Dr. Loveleen Brar told just now. So बच्चों, जब हम बात करते हैं ऑन्कोलॉजी की, तो दो तीन सवाल हैं जो हमेशा हमारे मन में आते हैं और आम तौर पे बच्चे इन टर्म्स से कई बार जागरूक नहीं होते. सबसे पहले तो हु इज एन ऑन्कोलॉजिस्ट, कौन होता है ऑन्कोलॉजिस्ट, एंड व्हाई हैव वी इनवाइटेड एन ऑन्कोलॉजिस्ट टुडे, एंड व्हाट हैज साइंस सिटी टू डू विद ऑन्कोलॉजी. So I would just want to let you know कि oncologist वो स्पेशलिस्ट होता है, वो डॉक्टर होता है जो कैंसर के बारे में रिसर्च करता है, कैंसर की ट्रीटमेंट करता है. और आज हमने इसीलिए डॉक्टर साहब को बुलाया है कि क्योंकि वो एक बहुत वेल नोन कैंसर स्पेशलिस्ट हैं. बहुत कुछ आप गूगल करिए उनका नाम और आपको उनके बारे में बहुत सारी बढ़िया बढ़िया इंफॉर्मेशन मिलती है, उनके काम के बारे में पता लगता है. और साइंस सिटी को में हम आज कैंसर अवेयरनेस या वर्ल्ड कैंसर डे क्यों मना रहे हैं, वो इसलिए कि साइंस सिटी एक साइंस कम्युनिकेशन फैसिलिटी है, नॉन फॉर्मल साइंस एजुकेशन का काम करती है. और कैंसर एक ऐसा शब्द है जो आज हम बहुत ज्यादा सुनते रहते हैं हर वक्त, और बहुत बार हम इस शब्द से डरते भी हैं. तो कैंसर के बारे में अवेयरनेस होना बहुत जरूरी है. क्या है कैंसर, क्यों होता है, कैसे होता है. ये भी कहा जाता है कि पंजाब में, अगर मैं पंजाब के कॉन्टेक्स्ट में बात करूं, तो मीडिया में बहुत ज्यादा आज से 4-5 साल पहले एक कैंसर ट्रेन के बारे में आया करता था कि जी पंजाब से एक कैंसर ट्रेन चलती है जो बीकानेर तक जाती है और उस ट्रेन में सिर्फ कैंसर पेशेंट्स होते हैं. और ये इतना ज्यादा था कि अल्टीमेटली गवर्नमेंट ऑफ पंजाब ने इस पर एक स्टडी करवाई थी पीजीआई के साथ मिलकर, पीजीआई चंडीगढ़ के साथ, जिसमें ये निकल के आया कि निश्चित रूप से थोड़े कैंसर पेशेंट्स उस एरिया में ज्यादा हैं, पर जो कंट्रोल एरिया जो रोपड़ लिया था उससे स्टैटिस्टिकली सिग्निफिकेंट डिफरेंस शायद उस वक्त नहीं आया था. पर फिर ये बहुत सारे कारणों की खोज की गई थी कि क्यों ऐसा है कि इस एरिया में कैंसर बाकी एरिया में पंजाब से थोड़ा सा ज्यादा है। और रीजन उस वक्त यही निकला था कि उस बेल्ट में वो कॉटन बेल्ट है, और कॉटन में बहुत सारे पेस्टिसाइड्स यूज किए जा रहे थे जो कार्सिनोजेनिक थे। कार्सिनोजेनिक वो सब्सटेंसेस होते हैं जो कैंसर कॉजिंग एजेंट्स होते हैं। पर अगर हम कैंसर की बात करें तो ये बात निश्चित है कि कैंसर, इट सेज दैट कैंसर सक्स, इट सक्स अ पर्सन, इट सक्स फैमिलीज। तो ये बहुत ज्यादा जरूरी है कि हम कैंसर के बारे में जाने कि उसे कैसे प्रिवेंट किया, क्या वो प्रिवेंटेबल है, अगर है तो कैसे किया जा सकता है उसको प्रिवेंट, और अगर हो जाए किसी को कैंसर तो उससे लड़ा कैसे जाए, किस वक्त हमें ट्रीटमेंट स्टार्ट कर देनी चाहिए, किस वक्त, क्या वो सिम्टम्स हैं जिनको देख के हमें इमीडिएटली डॉक्टर के पास जाना चाहिए। ये सब अगर जानकारी हम सारों के पास होगी तो हम ज्यादा जागरूक होंगे अपनी हेल्थ के बारे में भी और इस बारे में भी कि हम अपने आप को कैसे बचा सकें। आज डॉक्टर ललित कुमार ने हमारे साथ आप लोगों के साथ बातचीत करने के लिए वो अग्री किए। डॉक्टर साहब, आपका बहुत बहुत शुक्रिया। मुझे पता है कि आप बहुत बिजी हैं, पर फिर भी आपने हमारे लिए समय निकाला, हमारे बच्चों को बताने के लिए, हमारे टीचर्स को बताने के लिए। एंड आई एम श्योर कि कुछ बच्चों के साथ शायद उनके पेरेंट्स भी बैठे हुए होंगे, वो भी सुन रहे होंगे। तो ये एक बहुत जरूरी इंफॉर्मेशन है जो हम सब तक जानी चाहिए। और इसीलिए मैंने आज की ये वार्ता हिंदी में ही शुरू की ताकि हम हर किसी तक पूरी तरह पहुंच सके। तो डॉक्टर साहब, मुझे मालूम है कि आप बहुत हाई एंड रिसर्च करते हैं, बट एट द सेम टाइम अगर हम बच्चों को या जितने भी हमारे श्रोता हैं उनको हम बिल्कुल सरल सिंपल भाषा में बता सकें। ये हमारे बच्चों को मालूम है कि कैंसर से बहुत सारी डेथ्स हो रही हैं, और इंडिया में भी इस वक्त जो है तकरीबन 1% पॉपुलेशन हमारी कैंसर से पीड़ित है। दुनिया में कहा जाता है कि पीछे जो लास्ट WHO की रिपोर्ट 2018 में आई थी उसमें था कि जी 9.6 मिलियन लोग कैंसर से हर साल मरते हैं, पर उसमें से तकरीबन 40% ऐसे होते हैं जिनका कैंसर ट्रीटेबल होता है पर वो टाइम पर ट्रीटमेंट नहीं लेते। तो आज जो हम अपने श्रोताओं को मैसेज देना चाहते हैं वो यही है कि कैंसर प्रिवेंटेबल है, कैंसर क्यूरेबल है, कैंसर कॉन्टेजियस नहीं है, ये तो हम सबको वैसे ही पता है, और अगर कैंसर हो जाए तो उसके बाद भी लाइफ है। हालांकि मैं यहाँ ये भी शेयर करना चाहूंगी इस मंच पे कि मेरी फैमिली खुद एक कैंसर पीड़ित फैमिली रही है, एंड वी हैव लॉस्ट अ फ्यू पीपल टू कैंसर. Probably we were not very much aware at that time. Probably we are better equipped now. But at the same time, besides the patient, there is one more important aspect related to cancer, is the depression and the trauma through which the family or the caregiver of a cancer patient goes. So I am pretty sure that the doctor has a very important role, because when a doctor talks to you kindly, when a doctor talks to you pleasantly, half of your pain goes as it is. And Dr. Saab, you yourself are such a pleasing personality. I welcome you once again to our platform, and I would not like to stand between our audience and you. The platform is yours. I hand it over to Lavleen to invite you formally.
Thank you so much, ma'am. Before inviting Dr. Lalit Kumar, I would like to introduce him to you. Dr. Kumar, a Fulbright scholar, is the professor and head of the Medical Oncology Department at AIIMS, New Delhi, where he focuses on multiple myeloma and gynecological malignancies. Dr. Kumar is known to have developed cost-effective treatment protocols for sustained bone marrow and stem cell transplantations. The government of India honored him in 2014 with the award of Padma Shri, the fourth highest civilian award for his contributions to the fields of medicine. He is also a recipient of the Indian Council of Medical Research Award and Renbexi Science Foundation Award. In 2008, the Government of India honored him with Dr. B.C. Roy Award, the highest award by the Indian government in the medical category. I invite Dr. Kumar to deliver his talk. So please.
Thank you, ma'am. Thank you so much. And Dr. Rajesh and Dr. Neelima and Dr. Loveleen for kind words. In fact, ma'am, आपने जितनी अच्छी तरह से summarize किया है, मेरे ख्याल है वो I think that's actually more than enough. So, so what I'm just trying to do it now that I know there are teachers here and some small children also, but I'll try to see that if I can really, it doesn't become too technical. And so I'll just try to summarize some of the cancer care in India, like what are the challenges and what are the opportunities which we have today. Now, cancer is a disease which really affects globally everybody. It is one of the major challenge to all the mankind. Now, if you see some of the figures, in 2012, there were 14.1 million new cancer cases, and it is estimated now that this number is going to be almost 23.3 million by the year 2035. Now, not only this, in India, if you see, like these are the 5 common cancers among males: lung, oral cavity, stomach, colon, and pharynx. And we see in the last column, we have the data from Punjab, Patiala. We have a cancer registry in Patiala, from where we have this data. So the food pipe cancer is the number 1 in Patiala, followed by lung, prostate, tongue, and mouth. Similarly, for women, you have the breast cancer, which is the most common, though compared to the North America and Western Europe, the incidence of breast cancer is low in our country, but it's still the number 1, like then followed by cervix, colon, ovary, and lip and oral cavity. While in Patiala, we have the breast, cervix, then food pipe again, ovary, and then gallbladder. So these are some of the differences which we are seeing. And the data which we collect for this cancer data, which I've shown you and which I'll be showing you, is that from the help of the national, this is the ICMR has started a cancer registry program in 1982. So this data is collected by 38 population-based cancer registry throughout the country. These are shown on the left side. You can see with on the right side, you have the hospital-based cancer registry with the blue dots, which are, I think, more than 64 in number. So what the registry, they still only accounts for almost 10 to 12% population of the country. So the data which and then this data is really collected and analyzed and then circulated. So which gives a kind of glimpse about the incidence, the prevalence of cancer, and what are the kind of pattern which we are seeing, and what are the stages of different cancers in different people come present to us. So which gives and make so the country, the government can be ready how to take the measures to really take care of some of the issues. Now, these are the data from you can see on the top, you have the Northeast state, different states where the incidence of cancer is very high. And then this followed by like you have the
Sorry to interrupt. Slides move नहीं हो रही हैं. We are still on the first slide.
Oh, okay.
Yeah. Thank you.
Can you see it now?
Yes, so we can. Yes, we can see the data slide. Right.
Okay, so you can see this. These are the like on the left side. This is the data from between 2006 to 2008, and then 10 years later, this is the data. And you can see the each bar, the horizontal bars which you are seeing, the is increasing, which shows the incidence over the years has gone up. And on the top, you have the northeast states where the incidence of cancer is very high, and then followed by the other states from the northern part and then the southern part, which we see here. And what you can show you like the some from parts of Kerala, where the between the let me just show you the between the this column is the rural based cancer registry, and Tiruvananthapuram is the urban based cancer registry. So you will find some of the difference between the rural based versus urban based, which will tell you that etiological factors which are operating or responsible for the development of cancer may be different from one area to another area. Similarly, in the women, same pattern you can see. The Kerala is unique in the sense that the thyroid cancer is very common there. And this is supposed to be because of the uranium content in the some of the sand near the sea. So which has a very high and possibly responsible for the high incidence of thyroid. Nowhere in the country you have thyroid cancer on the number 2. This is the only place in the country, and a small part in the Meghalaya in northeast where you have the incidence of thyroid cancer is also very high. And they are also probably supposed to be because of the uranium content there in the mountains. Now, what is important to realize is that the incidence of cancer, the tobacco-related cancer is almost 36 to 42% in males in the part of the Kerala. And in women, it's from 10 to 12% of the cancers. They are basically tobacco is responsible for those cancers happening in women too. Similarly, like if you see in Punjab, like the esophagus, as I said, the most common cancer in men, followed by lung, prostate, tongue, and mouth. So you can see the pattern is so different from the south part, like from compared to Kerala. While on the right side, you see in women, the breast, cervix, and the esophagus, again, number 3. So there is something different in our diet in Punjab, which possibly is responsible for the having the food pipe cancer being so common in males and being third commonest in the women in Punjab. What we have seen in India is that there is number of cancers. Overall, the incidence of cancer has gone up by nearly 2.7% in men and 3% in women. And some of the cancers which have shown there is trend for increasing in the colon cancer, rectum cancer, lung cancer, breast cancer, where incidence has gone up by 4.7% in women, and uterine, ovary, and prostate cancer. While cervical cancer all over the country in general have shown the downward trend. And as you can see, like these are the data from the different cancer registries, both based in the Bangalore, Chennai, Delhi, and Mumbai. And you can see both colon cancer, rectum cancer, and lung cancer in women, and breast cancer. There has been slow and steady rising the graphs, showing that the incidence is gradually rising over the years, over last 3 decades. And similarly for prostate, uterine, and the ovarian cancer. Cervical cancer, both in the urban waste as well as rural waste. Barsi is a place near Maharashtra. In Maharashtra,
sorry, we are still on slide 7. So please press F5.
F5.
Yeah.
Oh. Is it working now?
Yeah, we are on slide 16. Yes, 17 right now. Slide show पे sir कर दीजिए. Slide show पे click करके on the top bar, fifth column, slide show. जहाँ पे home, insert, design, animations, and slideshow.
Are you able to see, ma'am?
Yes, sir, 16 slide, right.
Slide number 16. No?
Yeah.
So what I was just mentioning, ma'am, that the incidence of certain cancers, there has been rising, like colon cancer, rectum cancer, lung and breast cancer over the last 3 decades. That's the data which we have from the various cancer registry, both urban-based as well as the rural-based cancer registry. While similarly for prostate, uterus, and ovarian cancer, the incidence has been slowly rising. But for cervical cancer, throughout the country, from both in urban areas as well as the rural area, the incidence gradually has been coming down. So like what is used to be nearly close to 40 per 100,000 in 1980s or early 90s, now this is coming somewhere between 15 to 20 in the last 10 years or so. So if you see like what is the risk for an individual to develop cancer in his lifetime? This is the estimated by ICMR, the Indian Council for Medical Research, based on the data which they have, that almost 1 out of 9 person will develop cancer, is prone to develop cancer in his lifetime, both male and female. And for individual cancers, like for example, if one wants to know that breast cancer, what is the risk for any person? The risk is almost 1 out of 30 women may develop cancer of breast in their lifetime. So that's the kind of risk. Similarly, lungs, almost 1 out of 68, something like that. So, so cancer is not kind of one single disease. This is a disease which really multiple diseases in itself, and it's a combination of factors which really responsible. So this is one of the major factors which has come out in the last 2 decades or so, that lifestyle, the way we kind of live, we kind of eat our food, and the kind of the lifestyle which we follow, and the environment. These are one of the major responsible factor causing the link with the cancer, and I will show you how. And then second, I would say the immunity, that how our immune system handles it. Some people may have lower immunity kind of things, they become more prone. And thirdly, there are certain genes which may go like some family may have a strong family history of cancer. So like we call them genetic or hereditary cancer. So almost 10%, especially the breast and ovary and colon cancer. These are the 3 cancers where the strong family history may be present, especially when the person develops the cancer at very young age. So is it working now okay or not?
We are on 14 number slide.
This is like
we are on 19th slide. We can see the 19th slide now.
okay. Achha. So the cancer does not develop over one day. It is a disease which takes long period of time. For example, this just to give you an example here, the cancer cervix. If you see the natural history, you can see the on the top. This is like how it develops, like the from dysplasia or like mild, moderate, and severe, and finally the carcinoma in situ, and then finally the frank cancer. And if you see in the bottom with the red arrow which shows the timeline, 2 years, 5 years, 15 years, and on the back, the bottom arrow, the green one, which shows that till almost 10 to 15 years, this is process irreversible. So if a woman develops the HPV infection, which may keep on having multiple times and will remains persistent infection, and then finally it may change into the carcinoma of cervix, cancer. So there is ample opportunity that you can reverse this process for almost 10 to 15 years, which gives you enough time for you to really reverse it. Similarly, like you can see the oral cancer, where the people can develop the some mucous fibrosis, leukoplakia, erythroplakia, which are so-called the precancerous conditions, and finally one may develop the cancer. And similarly, in the colon cancer, where you have the small growth we call adenoma, and which may enlarge with the time and becomes large adenoma, and finally there could be cancerous changes which can develop. So again, this whole process may take from 10 to 20 years time before person develops cancer. So if I just summarize, like what are the causes of cancer? So like you will see that the 1/3 of cancers are related to tobacco, directly or indirectly. Then another 1/3 are related, the cancers are related to the diet, the type of food we eat, and maybe 20 to 30% are related to the infections, which may cause cancer, and remaining 1 million or 10% of cancers are possibly linked to the environment pollution, insecticide, pesticides, automobile pollution, radiation, and some probably unknown factors, including stress. So these are some of the smoking or chewing tobacco patterns which we normally see in our community in different parts. Different people follow either the simply cigarette or bidi or kind of thing, or hookah. And what is more worrying is that like things like pan masala or gutka and those kind of things, which are equally bad and responsible for development of oral cancer. So these are something which are clearly known to all of us, which may be responsible for the oral cancer. And this is not the oral cancer. Like often the people ask, like one of my friend, that he was smoking throughout his life, he never had problem. Another person who never smoked but developed cancer. So like if you see this table which shows that patients who, people who have the, this is a relative risk, compare, like for example, 21 times higher risk of developing lung cancer if one smokes compared to those who do not smoke. So this, that means there are many multiple factors which may be responsible. Similarly, like the oral cavity, the food pipe, stomach, and so on and so forth. So there are multiple cancers which have been linked to the people who smoke or chew tobacco, both in men and women. Similarly, like if you, I showed you there has been trained for certain cancers where it has been increased both in men and women. If you can see on the bar diagram on the right side, while the bottom, the bars, which are the orange one, which show there is some decrease in the incidence of cancer in some of the cancer registry, tobacco-related cancer, which have been shown that decrease in the cancers. Now, coming to the food, like Hippocrates, which was one of the greatest physician, Greek physician, almost 2000 years ago, he said that let food be your medicine. Let your food be your medicine. So he always believed that the whatever we develop, whatever the disease we have, is they are linked clearly to our food which we consume. So now, for example, today we know that the diet is one of the important factor for cancer, like especially the high fat diet is responsible for the breast and prostate cancer, while spicy and fried food is responsible for your food pipe and oropharynx cancer. So like in Punjab, we see the high incidence of esophageal cancer. So we have to be careful that try to avoid the fried and spicy food. Similarly, smoked food, which is one of the practices in Northeast, the stomach cancer is very common there. So that is the probably one of the link which people have shown. And again, the groundnut infection like aflatoxins in some parts of Andhra. Again, this is something which is linked to the liver cancer. And we very well know that those who take less of vegetables, less of fruits, or low fiber diet and high fatty food or non-vegetarian food, they have a high incidence of colon cancer. So these are some of the very clear links which have been related to some of these cancers. And you can see in some of these pictures from the northeast, the different kind of food which they preserve, use the preservatives to keep the food for future or store it, or smoked fish, etc. So these are some of the potential factors or links which are related to the some of the cancer which people develop. What is another important thing which has happened in the last 2 decades or so? The epidemic of the overweight and obesity. And we now clearly know that BMI, if BMI is high, people who are overweight or obese or extremely obese, those are the people who have a higher risk for developing either breast cancer, especially after menopause, or colon cancer, which I showed you one of the pictures, food pipe cancer, especially the stomach and food pipe junction, that's called adenocarcinoma, kidney cancer, pancreas cancer, gallbladder cancer, and uterine cancer. So these are some of the cancer which are very clearly linked with the people who are overweight or obese. We have the link with the infections like cervical cancer. I am sure all of you are very much aware that HPV infection is clearly linked with the cervical cancer. Similarly, the hepatitis, both B and C, they have been clearly linked with the liver cancer. We have EV virus infection, which is more common in the northeast part of our country. And again, those who are stomach cancer people have shown Helicobacter pylori is one of the small bacteria which if we are eating a lot of junk food and causing this gastritis, which may responsible for this particular stomach cancer. There are many other cancers which may be linked to the viruses, and the pollution, like you can see the picture in the top from Delhi, you can have so much of pollution, or you can have the biomass pollution from the biomass at home. One of the picture from Peruvian country. Arsenic, some parts of our country, like particularly the parts of West Bengal, Bihar, and Bangladesh, where the incidence contamination of arsenic in the groundwater is very high, and there have been cases or increased incidence of cancer, some of the cancers in these areas. Then automobiles and like DDT, insecticide, pesticide, as I mentioned just now. So some of them have been linked that they could be responsible for some of these cancers. When we talk of genetic cancers like ovarian and the breast cancer, almost 10% of women who have the strong family history where more than 2 members or more members have been affected, especially in the young age, one has to think possibility of the ovarian cancer. And today we are able to do the BRCA1 and BRCA2 genes, which have been clearly linked with the both ovary and breast cancer. So now, are there methods we can prevent some of these cancers? So yes, certainly we have seen that tobacco is one of the most important in 1/3, 30 to 40% of the cancers men and 10 to 20% of cancers in women are clearly linked to the tobacco. So not only raising awareness, educating community, making some rules, regulation, legislation, and community participation. Just only legislation will not really help unless the community participates, understand that it's important to not to use tobacco, and that's why so many laws have been made that all these such shops should be 100 meters away from the school premises. Similarly, alcohol, one of the major issues in some parts of our country. The diet, we have to ensure the diet is rich in the vegetables, fruits, and we should avoid eating red meat. and some of the sources of the fat, especially the dairy products, the etc. So one has to be careful that we try to minimize those things. And of course, that we should try to maintain the weight, try to reduce the weight if the weight is overweight side, and so that we do not develop some of these cancers in future. Importance of regular exercise, keeping fit cannot be overemphasized, and some of these cancers, like we can maintain our weight, can really help to reduce some of these cancers. And of course, the control of infections have more than 1 decade, which is being used by the people and given once 2 doses. And in fact, there is some data recently saying even 1 dose may be good enough. So between 9 to 26 years of age, HPV vaccine has been advised to the people. And finally, let me say that the walking is the man's best medicine. Again, Hippocrates said this. So if we do regular exercise, the incidence of colon cancer can be reduced. And one of the hypotheses is that when we consume high-fat diet, there is increased formation of bile acids and fatty acids, which leads to the cell proliferation. And some of us are able to repair this damage and do not develop the problems in future. But those who have the defective mechanism of repair, they can have mutations, and finally it may develop into colon cancer. So what actually exercise does it, that it when you're taking the fibers, vegetables and fruits, the food which is rich in the fibers, that make the stool bulky and dilute these carcinogens. And also they bind to fatty acids and they reduce chance of further proliferation. And physical activity not only increase the peristalsis movements of the bowel, so therefore they decrease time in contact between bile acids and the underlying covering of the colon or mucosa. So these are some of the things which can really help to prevent the colon cancer. Now, government has taken some steps, and in 2016 they came out with the screening programs, and they have started this oral and cervical and breast cancer screening for the individual between 30 to 65 years of age, and this done once in 5 years. So this program was started in more than 450 districts in 2016. In last 2 years, because of COVID, I think there has been some slow in the progress, but this is something very, I would say, very important program, that by doing oral visual examination or visual inspection for cervical cancer or clinical breast examination by the local people or the midwives or ASA workers can help, and in case they find some suspicious, then can be referred to the nearby community health center or district hospital for further evaluation. So these are some of the steps, like the first step seen by the ASA worker or midwives, and then subsequent refer to the higher centers. As I said, the stress also could be one of the factors. Some people find that I'm very stressed, or they. So many of us have been practicing like some of the relaxing exercise like yoga, meditation, pranayam, all kind of breathing exercise are available in all parts, and for these have been like for thousands of years. People have been practicing, which helps them to energize their body and relax the mind. And any stressful condition, and cancer of course is one of them, can really some of these things do help to reduce your stress and possibly reduce the severity of the cancers in such cases. Let me just share with you some of the data on the how the things have improved in the last 2 decades or so. Now, these are the two individuals who have really paved the way for the development of many chemotherapy medicines, what we see today in presently. Now, one of the type of leukemia, acute lymphoblastic leukemia, is one of the commonest leukemia in children. And you can see now what used to happen in 1960s or 70s, the less than 20% of the children, in fact 10% used to survive. Now today we have almost 80 to 90% of children living with the getting cured out of this leukemia. And almost similar data, as you can see on the right side, from two major centers from India. And another leukemia, chronic myeloid leukemia, these are the people who did huge amount of work. And this was the one of the particular chromosome which was first time identified that linked with the particular cancer. And chronic myeloid leukemia was the one where the first time in any cancer, the people found that the chromosomal defect may be responsible. And what we know today is that the drug which is known as imatinib or Gleevec, this was the drug which was discovered in 1999, and from 2001 onwards, it was available throughout the world for the treatment of this particular condition. And what you can see today is that the survival with this for this leukemia has gone up from 8 or 9 years, which used to be the average survival today from 25 to 30 years, which is almost similar to a person who without leukemia will survive in the community. Some of your children here who may have listened the name of this Siddharth Mukherjee. He's one of the medical oncologists in Columbia University in New York, and he written this book, The Emperor of All Maladies. It's a very famous book, very scholastic book, and those who have not read may probably like to read if they are interested in the history of science. It's very, very nicely written. And these are the pictures from this book. On the left side, as you can see, these are some of the soldiers who died in the Second World War due to the exposure to the mustine gas, which the Italians and Germans, they used over their counterparts to really, and thousands of people died because of exposure to this drug. And when the autopsies were done, people found that the drug, which was mustine gas, which it also has an effect on the lymphomas. And in fact, till we had the better chemotherapy drugs, almost till 1980, late 70s, this mustine was used for the treatment of Hodgkin's lymphoma. Of course, it was a difficult drug, so now no longer used, it has been banned. And what we use, some of the chemotherapy drugs, and you can see that for early stage of Hodgkin's lymphoma, 90% of the people are cured. Similarly, in the advanced stage, almost 70% of people get cured. Now, similarly, I'll just quickly show some of the slides. For cervical cancer today, we use the chemotherapy and radiotherapy combination, which is being used for the treatment of cervical cancer. And this is the data which have shown that the combination is superior to only radiation by the cancer registry from our own country. Similarly, for breast cancer, those who have early breast cancer, a small tumor in the breast, then one can do the breast conservative surgery. That means you only remove the affected tumor part around this 1 centimeter. Do not remove the whole breast. And it has been shown from our own data that almost for stage 2, the 5-year survival is almost 85% people, women remain okay. And for stage 3, this number is almost 70%. So it's very important that we diagnose these people early. When you don't have to remove the breast, you can just do the limited surgery for the breast and can treat them with the good outcome. What we know, another change which has happened in the lung cancer today, that lung cancer, when we were students, we used to identify that it has only 2 types of lung cancer. But today, now in last 15 years or so, there's so much of change has happened that we know that it is not one disease, but multiple small subgroups which really make this so-called lung cancer. And we can identify some of these mutations, which they have shown is the small pie thing. And if those who are identified to have mutation, and if you treat them with this particular medicines which are now available, the survival is much, much better. So it's not unusual to see some of the lung cancer patient living for a couple of years, even with very, very advanced disease, which was not something possible till about 15 years back. And there are a number of drugs which, if you have a particular mutation, then one can use a particular drug. So that way one can be very, very specific for each individual patient. So that is what we call it the, so very precisely you can treat the drug. The other thing which we have is this, when we talk of cancer treatment, we also have to remember this is the one disease. So there has been always proverb that poverty brings disease, illness, and illness brings poverty. So this is always true for many of the chronic diseases, and cancer is one of them. So if you realize that the cost of the treatment has gone up in the last 2 decades compared to, like, if you see what used to be the cost in 70s, 80s, and 90s. So that is something, and there are a number of reasons that why so-called the cost really has gone up. Which people, that is one of the reasons that people delay the treatment, people stop the treatment in between, and which may be one of the reasons that why the results may not be so good. So these are some of things which really has to come. Fortunately, now we have this Ayushman Bharat scheme, which provides almost 5 lakhs rupees to each family for treatment at secondary and tertiary center. So therefore, the theme of today's topic seminar by the World Cancer Day theme was inequities in cancer care and how to really close the gap. So that is something which I think I will leave you with this thought, that these are some of the steps which really are happening. There has been slow and steady good progress, but still, still we really have to make efforts. Therefore, finally summarizing, the cancer care is not a one-step thing. It starts from prevention and screening for early detection. So we can pick up these people in the early stage 1 and 2 when the outcome is much better compared to stage 3 and 4 or advanced disease, we call it. Diagnosis early, making efforts, treating properly, precisely, so that minimum side effects happen, and those who survive, and those who are very sick and terminal, so really to take care that so they have a peaceful outcome. And not only so, as a part of the medicine, is a responsibility, or it's what we feel, we have to have a humane approach in our dealing with a disease like cancer, so where we can really look after the people in the bottom as well as people in the top in the ladder. So with this, I would like to really thank you so much for your kind attention. And these are some of the colleagues who helped me to prepare these slides for you. Thank you so much. Oh, ma'am, you.
Thank you so much, sir. Thank you so much for sharing this valuable information on cancer, its causes, prevention, and treatment. We'll be taking questions now.
Sure,
you may please raise your hands or inbox us. The participants who would like to ask questions may please raise their hands. Okay, there is a question from Kamaljeet Kaur. Can removing genes responsible for spreading cancer genetically may help in reducing the chances of breast cancer?
Okay, actually you cannot reduce the genes. The genes are not located in one cell. They are throughout all your cells in the body. So what is really happening, that some of the families which are prone for developing cancer. As I said, up to 10% who can have the strong family history. There is currently what we call the risk reducing surgery. So once you identify this particular gene, if they have present in the carriers, like for example, a mother has a cancer, suppose the daughter also turns positive for that particular mutation, but it still has not developed. Sometimes they want that I don't want to, so that I should remove the risk that in future I don't develop the cancer. So what general recommendation is that after the age of 35, it is expected they would have completed their family, so they can undergo the removal of ovaries so that the risk of developing ovarian cancer becomes minimal. Similarly, for the breast, they just remove the glandular part of the breast, so the risk of developing breast cancer is reduced. You do not remove the complete breast. Similarly, in the ovary case, you remove the tubes and the part of the ovary. So I would say that these surgeries are being done very carefully because they have a lot of psychological issues also. So the people who have to undergo have to understand very carefully. The surgeons who are going to do it, they have to take very conscious decision. This is to be done, and it may prevent the risk of recurrence, risk of having cancer by almost 85%. But still 5 to 10% people may have the risk. That means, and not everybody who has this particular gene or mutation will develop cancer. That is also true. So one has to take this risk assessment very, very carefully. So that part is there. And there certain drugs are also being used, hormone agent drugs, especially for the breast cancer, which can be used. But this is the one field which now is really growing. So people are now trying to see how it can be done.
I hope, Kamaljit, your question is answered. So there's another question from Lovepreet Kaur. Is cancer a curable disease?
Yes, I have shown you some of the graphs. I don't know whether you understood. Like leukemia, I have shown you that the results are like people are living 25 years, chronic viral leukemia, acute leukemia in children, your results are almost 90%. These are the results. Like that means if you remain leukemia free for a number of years, beyond 3 or 5 years, then generally we call it has been cured. So those results are almost to the tune of 80 to 85%.
Okay. Jasleen is asking how a person comes to know that he has cancer, any one particular sign of the disease?
Yeah, there are many signs of the cancers, like they're called acronym called caution. So which has multiple, which are like people have made like 6 or 7 signs, different sites. So like for example, if you have in mouth a small ulcer which is not healing for a long period of time, similarly the change in the voice, or somebody brings blood in the sputum, or husky cough. Similarly, if you have a lump in the breast, especially after the age of, say, let us say 35 or 40 years, and which is growing inside, which is not painful, and which the changes in the nipple size is reduced, or the breast size has become smaller. So there are certain changes which, and similarly the bowel habits have changed and persist for beyond 2 weeks or 3 weeks, then one should suspect there is something wrong, or at least should take a medical advice. So these are some of the signs. Weight loss is one of the signs, like people have been losing weight in absence of diabetes or thyroid problem or some other major problem. Then these are some of the signs.
So there is a question from Sapanpreet Kaur.
Okay.
Is there any way to reverse the translocation CML, like through gene therapy or something?
Yeah, actually for translocation, because this is a balanced translocation, this is not a single particular amino acid change. So therefore this drug, what it does is that imatinib, which I showed you, I did not explain in that figure, that this is a tyrosine kinase enzyme inhibitor. So it stops the phosphorylation. So for that phosphorylation, you need to have the ADP to ATP. So basically there are 3 molecules of, so the third molecule is occupied by this drug. So therefore, this process of from ADP to ATP is not there. Therefore, phosphorylation is stopped. So, but I don't think we have particular gene manipulation or something so that we can change this gene. I mean, that process, like people are trying in the thalassemia, people are trying sickle cell anemia, but those are the single amino acid issues. So there you can change that particular single gene. So, but this is like their BCR ABL gene, which is there. People have tried, but this since now drug is so effective that you are living a normal life and with the minimal side effects. So that is what is happening.
Okay. So there is another question in the chat box. The signs and symptoms of COVID-19 infection and early stage lung cancer or COVID-19?
Sorry, I did not understand the.
Sir, the signs and symptoms of COVID-19 infection and early stage lung cancer are same. How to know if your symptoms are due to lung cancer or COVID-19?
No, actually, that should not be major issue because COVID infection, you'll have the like the fever, the cough and body ache, and which is a temporary problem. This is a transient problem, and within 5-7 days you are better once your treatment is done. But lung cancer is like a small patch, and then you really have to see it, follow it up. So initially you investigate and do all kind of things. So I don't think that really is a major issue. At least that's easier to separate these two processes.
Okay, Vishal, please unmute yourself.
Hello, good evening, sir. Sir, it has been a really informative. Your lucid explanation really clears almost all doubts, sir. But still, I have a question. Yes, sir. Sir, do you believe that in near future we will develop any vaccines? That we know that vaccines they can be very effective if we get that vaccines in a very early stage, so that we can protect ourselves from the cancer-like disease. And one more question, sir. In your presentation, you were showing the slides. In one decade, the graph is steeply increases, and on the other decade, for the same region, it decreases. So, what were the findings at that moment? Why it comes down? And so can you tell about this, sir? What were the findings? Why it come down in the next decade?
Okay, so the first question was the will we be able to have some vaccines in future? So I said that we have the vaccine for some infective causes, like for example, HPV vaccine, which is available, which is quite effective, but this is effective for prevention. But if you have a cancer itself, and then this vaccine not effective, that's number one. Similarly, the vaccine for hepatitis B, that's why hepatitis B vaccine has been included in the childhood vaccination program. So hopefully next 20 years, once I think now so probably all the schools, they are generally practicing that that kids get the hepatitis B vaccine. So hopefully next 20 years, the liver cancer incidence definitely should be much lower, and at least in India. And I mean, this is something which people have shown in the like Hong Kong and Taiwan and many other countries where they have followed this vaccination program long back, because the incidence of liver cancer was very high there. So we hope that similar thing would happen in India. But many other cancers, as I said, they are not the single disease. And like colon cancer, this is related to your diet clearly. Similarly, food pipe, pancreas, many of these cancers, they are related to the. So it's very difficult to make one single vaccine which can take care. So it's going to be a long-term kind of process. So we really have to change our lifestyle, about our food habits, about exercise, and all those things. And those who smoke and those who take alcohol, they really have to. So there really no kind of replacement for these things. So that is about the vaccine. But people are, of course, are trying if something can really work out for some of these cancers, especially those which are related to infection. And so vaccine will only work in the very early stage or the preventive stage. That's number one. Number two, the graph which I had shown that cervical cancer incidence has been coming down, but other cancers, the data which we have, the number of cancer cases is not really, is rising gradually, slowly. That's what I think you probably, is that the, does that answer to your question?
Yes, sir. Sir, actually, one more question there is कि जैसे किसी को detect हो जाए, तो should we believe on the first clinical trials, as we know that sometimes it वो जो clinical trials में आता है वो सही नहीं होता. So should we need second opinion, or should we go for another twice or thrice time checking
Actually,
that process?
we always believe
Because it
that
happens around us. So many times it happens कि sometimes कोई चीज होती नहीं है, and still we are getting that treatment.
Right. So, no, I understand what you're saying. This is very important in the sense that when a diagnosis is made, one has to be ensured that you really have a complete proper diagnosis. For that, obviously, if you consult in a nearby tertiary care hospital where people have more experience, so at least you are sure the diagnosis is correct and the investigation which have been done, and then once that is done, then obviously there is not a problem. So I know there's still a problem, that is many smaller places we may not have the qualified people, so sometime we may have this kind of issues. So
thank you, sir. Thank you very much.
Okay. So okay.
We'll be taking this question.
Can I take lead
Last
now?
question, I guess. Sir, Sapanpreet is asking.
Okay, so maybe can we just last
sir, just
question?
one last question.
Okay.
Suppose a patient with, yeah, this will be the last. Suppose a patient with CML is taking imatinib for 7-8 years. Do the patient need to take it all through his life, even if the reports are normal?
Now, initially when it was started till 5 years back, we were saying that people have to take lifelong, and many people are taking in 20 years or so. But in last 5 years, now we have the test available which can detect the CML cells at molecular level by doing PCR test. We call it real-time PCR test. And if those people who have taken more than 3 years or more than 5 years and they continue to remain PCR negative for at least 2 or 3 times in the last 1 year, then probably there are now 5 or 6 trials which have shown that you can stop or withhold the treatment, stop the imatinib tablet, and 50% of these patients continue to remain without any treatment for many years. But 40 to 50% people may have these at molecular level relapse back. In those cases, you may have to restart again. So at least, yes, the answer partly that in 50% people, you are able to stop the drug completely after 5 years.
Yeah, thank you so much, sir. Now I request Dr. Rajesh Grover, Director Pushpa Gujral Science City, to deliver vote of thanks. Sir, please.
Thank you, Dr. Loveleen, and good evening, everybody. And I deem it a great honor to have been asked to propose a vote of thanks to our esteemed speaker and guests on the occasion. We are really grateful to Padam Shri Professor Lalit Kumar, Head Department of Medical Oncology, AIMS, and really for sparing his valuable time for his very busy schedule. I must say that he was with us to deliver a talk on cancer care in India, how much we have achieved. Thank you very much, sir. And the major takeaway I consider from your talk is that good diet, lifestyle, and awareness, education, and early detection are some of the keys to cancer care.
Absolutely.
Please accept our thanks, sir, and for enlightening talk and gracing the occasion. And I would also like to express my gratitude to Dr. Nilima Jairath, worthy Director General, for her presence, moral support, and sharing words of wisdom at the occasion. And I also take this opportunity to convey our hearty thanks to all our guests and participants who joined us on this platform and made this session a very interesting and interactive one. And last but not the least, I extend my sincere thanks to my colleagues at Science City, especially Dr. Loveleen and Ms. Manpreet Kaur, to organize this webinar and make it a success. In the end, I once again thank you all. Thank you very much.
Thank you, sir.
Thank you.
Thank you so much, sir.
Okay, thank you, ma'am.
It was great having you.
Okay, thank you so much.